सर इसको स्क्रीन को बड़ी कर लें। अस्सलाम वालेकुम guys, hope you all are fine. Today I am with Dr. Naghman Zuberi. He's a guest speaker and he's going to deliver the lecture on about becoming a licensed dentist in Canada. Basically, it will be a entrance exam, Canadian license of exam of dentist. So I would like to first welcome sir. Sir, I hope so you are fine. Assalamu alaikum sir.
Alhamdulillah, walaikum ji. Thank you very much. I am good, Alhamdulillah, and hopefully all the viewers they would be also good.
Yes sir. Sir, now you can continue with the lecture.
Thank you very much for giving me this opportunity to deliver certain like a few minutes of lecture on this. It's not a lecture actually; it's kind of an introduction or a quick review. How to become a licensed dentist if you are a foreign qualified dentist coming from other part of the world. So how you get a license to practice in Canada, that is the actual. And I was getting a lot many queries from all over the world that can you please guide us, can you please guide us. So thank you for providing this opportunity. So here we are, how to become a licensed dentist in Canada. We have two methods of getting the dental license. One is if you are graduate from an accredited dental program. To get the list of the accredited dental programs, you can go to the National Dental Examination Board of Canada's website, and it will provide you all the lists. Like definitely all the Canadian dental schools, they are in that list. Then all the United States dental schools, they are also in that list. Some of these schools from Europe and some of these schools from Australia and New Zealand, they are also there. And there are certain dates that from Australia, if you got the degree after such and such date, then you are considered as coming from the accredited dental program. So over there, like for that process, you have to go for the NDEB certification process, then NDEB written examination and OSCE, and then finally you will get the NDEB certification. Then you need to get the provincial license. Here, the license to practice the dentistry, once you get the certificate from National Dental Examination of Board of Canada, then you need to get the license from the province as well. We have Canadian provinces like Ontario, Quebec, Manitoba, etc., etc., Nova Scotia, etc., etc. So from the governing bodies over there, you need to get your license from them as well to practice in that particular province. You can get license from 2 or 3 different provinces at one time. That is not a big deal. So some people I know that they work like for a couple of weeks in Ontario, and then they fly to northern parts of Canada and go there and work in reserves because they have license for those provinces as well. So they go there and then they serve the government in reserves. Most of us, like those who are migrating to Canada, who are immigrating to Canada, they are already licensed in their respective countries like Pakistan, India, Middle East, or Far East, or somewhere in African continent or wherever. So we have either just a basic dental qualification and we are working as a general dentist, or we have a dental specialty, like after doing this we have done some MDS or some MSc or something like that. So they are considered as the dental specialists. They have a separate if you want to go, like all these specialists, they can take this path as well, But if someone says, no, 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 I'm just good with my orthodontics, or I'm just good with my endodontics, and I want to pursue my career as a specialist in Canada, so they have a different path. But if you have like a master's degree or MDAs or whatever, fellowships or everything, and then you still want to go through this process, you can continue with the process of getting the license as a general dental practitioner in Canada. So over here, first of all, you have to get your, like you have to start your equivalency process. You have to go to the website of NDEB. Over there, you will firstly click on the link of non-accredited dental program, and then you will follow the general dentistry program. Then you will start with the process of making your profile on the website. Then they will ask you to submit your uh, documents with them, which will be sent directly from your university to the NDEB in Ottawa. Once your documents are approved, then you will go for the assessment of fundamental knowledge exam. This is the first exam. After this exam, you have two options. If you are arriving in Canada as a permanent resident, or you are already a citizen in Canada, or already a permanent resident in Canada, but you went back home to get your degree, your completion of your degree over there in your respective country of origin, then at this level you have two options. But if you are not a PR or you are not a citizen, then you have to only follow this path, where you have to go for two other further exams. One is assessment of clinical judgment, and the other one is assessment of clinical skills. If you are a PR or you are a citizen, then you have two options. Either you can follow the same path of appearing in two further exams, or you can go to the dental school and then get your degree after studying 2 to 3 years, depending upon the university you are joining. Few universities, they offer 2 years program. Few universities, they offer 3 years program. If you get selected, then you have to complete your 2 to 3 years of program over there, and you will be awarded a DMD or DDS. And then again, the same process of appearing in the NDEB written examination and OSCE. If you are following this path of giving two further exams of clinical judgment and clinical skills, after clearing these exams, after qualifying in these exams, then again you have to go for NDEB written examination and OSCE. This exam is for everyone, no matter you are coming from the accredited dental program, or you are coming from the direct license stream, or after your AFK exam, you have joined the qualifying degree completion program of some dental school, and you've been awarded your DDS or DMD. Everyone has to take this exam, NDEB written examination and OSCE exam, and then you get certification. And finally, the same thing, you have to go to the province where you are intending to practice and get your license from there. Dental specialty, like it is first of all, you have to apply with all your credentials to NDEB, and then if you are approved to appear in the exam, then you have to take the NDEB dental specialty core knowledge exam. It is quite an extensive exam, and then after that you have to apply to the dental schools, where they will give you training according to the Canadian norms in the respective field. And after that, you have to give the RCDC examination to get your license as a specialist, and then you can practice. NDEB equivalency process. As I told you, I'm talking about the general stream, general dentistry program. I'm not discussing about the specialty program. So over here, you have to make your profile at this website. Send your documents for evaluation to NDB. Every country they have deal differently, and they will ask you to at times send your original documents. At times they ask you to send the documents through the university. So whatever the procedure is, they will guide you accordingly. And once your documents will be evaluated, like they will arrive over there, then they tell you that okay, the documents are with us. Your dashboard of your profile will confirm that your documents arrived and now they are under process. It takes at least 5 to 6 months to prepare the exam, and meanwhile your profile is going to be approved for appearing in the exam of fundamental knowledge. This exam, it was occurring twice a year before the COVID. February 2020 was the last exam conducted by NDEB. The August exam, because of COVID, is postponed. So over here, we are still not, because they say that they are going to conduct the exam in December 2020, but the students, the aspirants, they didn't get any confirmation so far that when and how, like they have given a date, but still the confirmation date is not there, like the email is not there. So, and how many people will be able to appear in the exam because of the social distancing. This AFK exam, or Assessment of Fundamental Knowledge exam, it has 3 chances to pass. If you are not able to pass this exam within 3 chances, then you will be out of this system. Passing percentile is 75. So you have to pass 70, and it is a bell curve exam. It is not that just you think that out of 300 questions, your questions were up to 75%. So you are, no, it is percentile based. And previously it was a paper based exam, but now because of COVID, the August exam, which is being conducted in December, it will be computer based, 150 MCQs in each part, and it will be conducted at the Prometric Center. It covers all the basic and clinical subjects. Then if you are going for the direct license program, then I'm not saying that it is the second exam. You can take this assessment of clinical judgment exam as second exam, or you can take the clinical skills exam as the second exam, or you can appear in both the exams together. So after passing AFK, you are eligible to appear either in ACJ or in ACS, or you can take both the exams simultaneously. So this assessment of clinical judgment exam, again, at least according to our experience, we say that 3 to 4 months preparation would be required for this exam. If you are a very good practitioner with good experience coming from back home, then probably it would be a little less for you. But for those who don't have too much of the clinical experience, this much time is required. 3 chances are provided to pass this exam. Again, if you are not able to pass this exam within 3 chances, then you will be out of the system. Same, the passing percentile is 75%. It is a computer-based exam. Even before COVID, it was a computer-based exam taken in 2 sections, and it is being conducted at the Prometric centers. Both these sections comprise of case scenarios with MCQs and multiple correct answers, as well as some periapical bite-wing x-rays with MCQs and multiple correct answers will be provided. So they check how you can assess a case, depending upon its history, looking at the pictures provided to you. So are you able to provide the correct diagnosis, and if you are able to go for the correct management of that case, etc., etc. In total, at least there will be 150 MCQs, 75 in each section. More emphasis in this exam is on oral medicine and oral pathology, periodontology, medical emergencies, management of a medically compromised patient in your dental office, etc., etc. One or two cases of orthodontics will be there. A lot much on pain of endodontic origin and its management. Different case scenarios, they will tell you about the quality of pain, about the history of present complaint, that the pain started like last night and it was very severe, or the pain is like lingering after having a cold drink or after having a hot tea or things like that. So, reading about the history and the history of like the history of present complaint, everything, then you would be able to identify like the origin of the pain, from where the pain is coming, what is the quality of pain, and you will give your diagnosis. Then definitely analgesics, antimicrobials, local anesthetic doses, they are also being asked for a particular patient. Questions on prescription writing. This is a very weak point when we come back, like we come from back home. Then prescription writing is a very weak point, which we have noticed. And for the last couple of years, probably from 2017, they have included this prescription in the ACJ exam. They will provide you with a prescription and they will ask you if it is appropriate. If it is not appropriate, then what are the reasons why there uh, like problems? So what would be the reasons that it is not appropriate? And you have to follow North American norms, not how the prescriptions are being written back home. Then comes this assessment of clinical skill exam. It is one of the most expensive exams, and its preparation is also very, very expensive. A lot of stress. It is on 2 days, extreme stress and pressure. Again, this exam has three chances to pass. Preparation time depends upon individual's clinical skills, how good you are in cutting a cavity, how good you are in preparing a crown, etc., etc. And please keep in mind, not like back home where you prepare a crown. Here you have to follow the protocol. The protocol is being provided by NDEB, and you have to follow that. This much, like 1.2 millimeter means 1.2 millimeter, or 0.5 millimeters means 0.5 millimeters. You cannot deviate from that. Or if like the taper is not more than 10 degrees, means taper should not be more than 10 degrees. So you have to follow those. The protocol is available on NDEB's website. 12 exercise you have to do. Class 2 MOD preps and MOD fillings on pre-cut teeth. At times they even ask you to build a cusp as well, using either amalgam or at times using composite as well. Then you have to go for a class 3 prep. Then you have to do a class 4 restoration, an endo access on a molar, then rubber dam application. You have to follow the North American standards for rubber dam application. You cannot argue. No, back home we've been taught like this for the application of rubber dam. Whatever the protocol says, according to the NDEB norms, you have to follow that. Then record keeping. You have to follow the Canadian standards for record keeping. Sterilization and infection control, they are continuously watching you during your exercises of 2 days, that you are following the protocol for sterilization and infection control or not. Full metal crown preparation on a posterior, then PFM crown preparation on a premolar or an anterior tooth, temporary crown on a pre-cut tooth. This passing criteria, that is on a grading system like A plus, if you have followed all the protocols and your work is following according to the norms. A, D, E. E means fail. So you have to follow the protocol as I told you, and that is made according to the columns: column A, column B, column C, or first column, second column, third column. So all that information is available on NDEB's website. You have to download that protocol from there. After passing your ACJ and ACS, then you have to go for OSCE and written exam. This exam is mandatory for every dentist. I told you earlier, whether you are coming from direct license track or you are a graduate of a dental school, no matter you have joined later, like you were already a dental student from back home, or you are coming from the very first year of dental school. So all the dentists, they have to, whether an accredited program or joined later, or you are coming from the direct license track, whatever the situation is, you have to appear in these exams. It's a 2 days exam, 3 chances are provided to pass, and again, the passing percentile for written is 75%. Day one is same type of exam as for your AFK written exam, computer based, and then you have to like 300 questions, you have to answer those 300 questions in 2 parts. Day two is OSCE exam with multiple stations and problem-based questions or case scenarios with most appropriate answers. So you have to, like you would be asked to circulate on the stations where certain problems will be there waiting for you, some x-rays or maybe some wrongly done filling or some crown with a short margin or whatever. So you have to identify the problems in that. On completion, NDEB awards license to practice, but it is not a guarantee, because further you have to go for the provincial authorities and they have their own regulations to provide you the license to practice in that province. Another alternate path, as I told you, that you can go for the dental school for 2 to 3 years after passing the AFK exam. Again, over here, the competition is very, very high. First of all, Canadian citizenship or PR is a requirement to get admission into the dental school. You should have a good GPA from back home, either TOEFL or IELTS. You need to pass this and you have to follow the instructions given on that particular university website, that what TOEFL score they consider and what are the IELTS score they consider. Every university, they have their own criteria. It is very competitive, as I have already mentioned. Like certain seats, I'm not sure, at times the seats, they increase, they decrease. So whatever the information I got from my students, I just providing it to you. Yes, Saskatchewan University has also started their program for last 2 years. So Saskatchewan University is also there. Previously, McGill University was only for Quebec residents, but now they take students from other provinces of Canada as well. As I told you that every university has their own criteria for selecting the students. University of Toronto and McGill University, they mostly rely on multiple mini interviews, as well as they consider your GPA from back home after the AFK score. They give quite a lot weightage to your GPA from back home. University of Western Ontario, also called Western University, they have a prior learning assessment exam. It's a 2 days of practical exam with 6 exercises on typodont, and then there is an interview. And for the last 1 year, they have even started training the aspirants for this exam. They have their own course, which is probably 10,000 Canadian dollars or something like that. And it is over a span of 6 to 8 weeks. I'm not sure about the time duration. So you have to take that course before you apply to the university for this prior learning assessment exam. Dalhousie University, they have 1 day of extreme stress exam with 2 exercises on the typodont, 1 written exam, and an interview. University of Alberta, it is 5 days of extensive practical exam, extremely stressful, with an OSCE type evaluation as well. Manitoba University, 2 days of exam, practical, written, and interview. And Saskatchewan University, as I told you, they have recently started their program. So they also have a bench test as well as an interview. Bench test means that you have to go for the practical exam on the typodonts. You have to do fillings, you have to do cavity cutting, you have to do crown preparation, etc., etc., and then an interview as well. Previously, UBC, also the British Columbia University, they were also having a program for the internationally qualified students, but at the moment it is temporarily closed or maybe permanently closed. We are not sure, but at the moment they are not having any intake. People also ask about how much money would be required. Well, a lot of money, I must say. Firstly, when you start your evaluation process of your documents, you have to pay fee to NDEB for that evaluation process, then fee for AFK exam, fee for ACJ exam, fee for ACS exam, fee for OSCE and written exam. You need study material. If you take some preparatory courses, then you have to pay fee for that. For your practice, dental materials, instruments, typodonts, simulated teeth for practice and training course cost. So almost 35,000 to 50,000 Canadian dollars would be required either to pass the ACS or get into the dental school. If you get into the dental school, then definitely you have to pay fee over there as well. Time required, if everything goes good, either to get into university and start with your DDS program or pass your all the exams for the direct license, almost up to 24 months. As I told you, cost for university programs, so fee for evaluation, fee for AFK study material for and preparatory courses, university fee, books, residence, computer, instruments and supplies. So almost just giving every university, they have their own criteria. So you have to contact the university, but rough estimate, this would be the 2 years cost. Time required after AFK, 1 year gap before classes are going to start, and then 2 to 3 years of schooling. Well, another method is if you want to get your DDS or DMD from USA, then you can practice in Canada and you will be considered coming from the accredited program. For that, now previously there were NBDE Part 1 and Part 2 exams, but now the system has been changed. There is one exam only which is called INBDE exam. You have to appear in INBDE exam, and then that is Integrated National Board of Dental Examinations exam. Then you have to take TOEFL for sure. No matter you were born in USA, you were born in England, you were born in Australia, doesn't matter. If you want to go to university in United States and you are a foreign qualified dentist, then you have to take this exam. DDS or DMD from USA. Get your evaluation done from ECE and WES, because some of the universities, they want WES as well. But to appear in the exam, the exam system, it needs ECE. The first exam, INBDE, which you have to take, so you have to go for ECE evaluation. Then you get your dent pin from ADA, which is a very quite a very simple procedure, and always keep this dent pin and your password saved. This is your identity with American Dental Association for rest of your life. Once ECE evaluates you, register for your exam with the JCNDE, Joint Commission of National Dental Examination. New system, as I told you, one exam only. Then there are certain universities which follow the CAPIT system. CAPIT is a portal, and here you have to apply on that portal system. You have to make your profile, then the documents they will ask you, you have to upload that. And there are certain non-CAPIT universities as well. They don't participate in this CAPIT system. There you have to apply to every, like those universities separately to every university and according to their requirements. Letter of recommendations are very, very important in American system, as well as your statement of purpose. These two are very, very important, and they play a very vital role apart from your score of INBDE, your TOEFL, your interview, your everything. But LORs and SOP are also very important. Few universities they hold interviews only, and few have bench exams as well as interviews. So depending upon the universities you are applying to, you have to prepare yourself for that. After qualifying, you have to pass regional board exams as well as like NERB, WERB if you want to get your license for USA as well. So you have to pass those exams. And then you can come back to Canada, and over here you will be uh, appearing for the OSCE and written exam, and then you have to go to the provincial authorities to get the license. So over here we are done with the quick review how you can get the license in Canada to practice as a dentist if you are a foreign qualified dentist. And hopefully it would have uh, provided you some information. So if any
Thanks a
questions,
lot, sir. Thanks a lot, sir, for a great lecture. I hope so. Every misconception and every ambiguity about questions about this exam would be cleared after this lecture. Sir, there is a question by one of the participants. What is the pass percentile for ACS?
there is no pass percentile, and if uh, you have to follow the criteria. If everything is good, they will pass you. It is grading system. There is no passing percentile for the ACS exam.
ठीक हो गया sir. Sir, thanks a lot again for the great lecture.
Any
Uh,
questions,
uh,
any queries, please let me know. And if you want to apply for like you want any guidance in application process to NDEB or something, you can always contact me. I can guide you, as well as I am conducting online courses for AFK as well as ACJ for the last 10 years. So anyone who wants to join my course, they can also join my course.
sure, sir. ठीक हो गया. Thank you, sir, for the lecture.
Very much.
खुदा
Thanks a
खुदा
lot.
हाफिज.